Thanks to the hundreds of people that joined us to the different sessions that we have throughout the day. In the next 25 minutes, I'm gonna share with you a little bit about Carbyne, what Carbyne contributed to fight the coronavirus worldwide, and I would love to hear from you if you have any questions, and happy to address all of them. In short, I founded with my great partners Carbyne 5.5 years ago in order to change the way people communicating in case of emergency with emergency services. Today, the company is a bit more than 100 employees. We're working from 7 countries worldwide, supporting more than 100 agencies and giving services to almost 250 million people worldwide. We are operating in a very big command and control centers and saving lives on a daily basis with the highest volumes of single PSAP with more than 45,000 emergency call per day. When the COVID-19 started, basically our teams around the world created focus groups with different personnels, especially from the health services, in order to understand what is the mission that they are trying to achieve. Immediately we realized that the most important thing is how can we reduce the loads on health centers, reduce the exposure of our frontline responders, doctors, but in addition to call takers, dispatchers, because at the end of the day, they are so essential and we want to keep them safe. How are we gonna synchronize multiple task forces in order to increase situational awareness? We have learned a lot, and I will try to cover some of the key lessons that we've learned during the COVID-19, and I will say that Carbyne is currently supporting more than, or deployed more than 17 projects in the last 3 weeks worldwide in US, Mexico, Peru, Chile, Europe, Israel, and some in Asia. So first thing, and I think it's, all the people in this webinar are pretty aware of how important location is for 911. And there is great companies such as Rapid SOS that we are partnering with, or us that are providing AML in other countries worldwide, that we all know that location is the key. But in those kind of situations, when you have a global pandemic and suddenly people are calling and you need to understand the location, because location is everything in order to understand what is happening under your jurisdiction, you need to have location for every call. So we are supporting 911, 311, health services, remote doctors, and suddenly you need location not only for 911 call in order to understand the spread and what is currently happening in your jurisdiction in response to the COVID-19. Citizens are expecting us to use better solutions, okay? They are used to do one click and to call via video to their families that are now abroad. They used to text all day, okay? And I gave some example of our partner, Tyrell from New Orleans, and from the governor of Hidalgo, demonstrating the solutions and the capabilities that sometimes citizens believe that we have them already in the PSAPs, such as chat with the call takers for people with disabilities, for the deaf community. They want to speak with you. How are they going to do it? Text to 911 is one option. Second option is regular chatting. Can you do it in your PSAP? Yes, no. Citizen expecting to it. Video, in these days, we are doing FaceTime with a click of a button. Why can't I share the video with my 911 centers? And we need to meet our citizens' expectations. We also saw a huge increase in video usage due to the fact that now people are calling to 911 or 311 or other centers in order to report they might have corona symptoms. Looking at the citizen's face, looking at the environment can give you a lot of other benefits that are crucial in order to fight the coronavirus. Interoperability, again, a second opinion. This thing is getting more important when we are talking about COVID-19. And the reason is that 911 centers are starting to receive calls, which are not emergency, about their physical status, about my health status, and asking a lot of questions. Do I have those symptoms? Do I have corona? Should I go to health centers? And sometimes call takers and dispatchers need a second opinion. How are you going to do it with someone who is not currently connected to your 911 or 311 environment. So for example, we at Carbyne, what we did, we built a data sharing mechanism that with one click, you can very fast share information with any agency or entity, or even with the doctor working from home in order to get a second opinion. But interoperability, not only internally in your 911 system, externally between 911, 311, other state government agencies, hospitals, doctors working from home, etc., etc. In addition, and there is a lot of, again, amazing companies talking about cloud for such a long time, and I will mention some, Mark 43, Rapid Deploy, Soma Global, great companies talking about the importance of using cloud. I think now more than ever, we all understand that cloud is here and we need to use it, okay? It can give you a lot of benefits that I think that are obvious for everybody, but 911 centers reported the fact that they are now getting much more volume of calls because of the fact that people are in panic and calling them. How you're increasing or decreasing the amount of call takers that you have in no time. How you're gonna give your call takers the ability to work from home and not put them in danger. How you're gonna dispatch forces from your home and understand in real time what is the situational awareness. How you're gonna push new solutions without being on your customer premises. As an example, and Tyrell will talk about it, when New Orleans called us and asked for the Carbyne COVID solution, in 3 hours after the first call, we deployed our systems. What you're seeing here on the screen, this is one example of coronavirus questionnaire that we have developed very fast, and with click of a button, pushed it to all our clients worldwide without being on their premises. So cloud is here, cloud is secure. There is great government clouds provided by Amazon, Amazon, Microsoft, Azure, etc. And we need to use them. They can bring huge benefit to our industry. In addition, what we've realized and learned, at the end of the day, government, states are now facing new challenge. Because in the end of the day, we want them to do and to make data-driven decisions, but how they are gathering the data. I can have my data about my 911 command and control centers. Of course, I can have it. This is no problem. And we are assuming that most of the agencies already having visuals of what is happening under your jurisdictions. But how are you going to do it when you need to now seeing everything from police, EMS, fire, remote doctors, 311, 911, different health organization, and having it all on a centralized domain awareness platform, okay, and see and understand exactly what is going on. And this is connected to the questionnaire that I showed you before as an example, where through the Carbyne platform, states and governments can easily filter, as an example, all the calls coming with a fever with more than 38 degrees, as an example, and immediately understand where the next spread is going to happen, okay? Just small example, but how you're going to unify all the information that you have in your state or in your city into a single source of information that based on that, you can drive decisions. How I can see it in different visuals and understand, again, in Williamsburg, that I have probably the next spread, and I need to allocate resources because in the end of the day, they are not unlimited. So I have limited resources, I have limited ambulances, and I have limited coronavirus tests. Where should I put them? Where should I use them? And how? This is what data can give you. In addition, mostly for state levels, we have developed a very strong and unique tool that basically giving you the benchmarking as an addition to what you saw before, in order to understand the benchmarking between the different PSAPs that you have in your jurisdiction. Okay, if as an example, in Fayette County, Georgia, we are seeing a huge volume of 911 calls, and we can see that a lot of people are reporting about fever now, so the state governor or the state emergency department can allocate resources, again, which are not unlimited, accordingly. The last thing that I will say before we will go to the questions is that, you know, we are working with amazing people, but in the end of the day, in the front lines, we have people sitting behind the phones or behind the dispatch solutions, and we are expecting them to handle with everything and to receive everything and to start dealing with new kind of data coming into the PSAPs. And we at Carbyne putting a lot of attention into that fact. And we're going to have a different session with Dr. Lilly, but what we have learned that due to this pandemic, our call takers, dispatchers, or different telecommunicators are now facing new different calls. Like people are calling for mental support. People are calling to say that they are starving because they're, I don't know, 90 years old and they cannot go to the supermarket to buy food. Okay. So of course, we are expecting our call takers and dispatcher to support them, but we need to support our call takers and dispatchers. And this is why we at Carbyne believe that supporting the mental health of your call takers and dispatchers is crucial, especially in those moments that are stressful. And in the end of the day, we are all human and we want to give them the best treatment as we expect them to do to the citizens that they are giving services to. This was my very quick lesson learned throughout the last 1 month. And Carbyne is happy to support the industry and happy to share anything that we learned with any personnel from the industry. And I think now we're gonna take questions from the crowd. Moti.
Yes, thank you, Amir. Thank you for this really interesting session. We have a few questions that are kind of streaming from the crowd, from the audience. The first one is, can you share with us a couple of examples of any specific outcomes using this solution, maybe from the deployment in New Orleans?
Yeah, for sure. So basically, I would expect Tyrell to talk about it deeply later, but I would say that few things that we've learned. First of all, time is everything, okay? You need to deploy solution very fast. You don't have time to wait, and you need to do it as soon as you can. So the timeline for the deployment in New Orleans was pretty, I think, one of the best records that we ever had. So 3 hours from first call to deployment, 15 hours from first call to fully train their personnel. And according to Tyrell, using our solutions, they had the ability to understand or better assist their citizens that are calling to report about symptoms that they might have. And the biggest risk was to people are in panic. People are feeling that they have coronavirus, but in fact, they don't have it. What they're doing immediate after that, they are going to the hospitals, and in the hospitals, they're getting the coronavirus, going back to their families, and everybody are infected. So how New Orleans used the Carbyne solution in order to assess remotely and understand what people have. This is a great example on how you can fight and flatten the curve. This is one example. You're on mute, Moti.
1 second, sorry. Thank you, Amir. We have another question from the audience, from Luz Martinez. How would you describe the cloud to an audience or to someone who isn't familiar with this from the industry? How would you convince them to take action and join the cloud?
This is a very, very good conversation. And I think, unfortunately, that post-COVID, the industry will realize better the need of using or mixing, maybe, on-premise and cloud solutions, okay? At the end of the day, enterprises are using cloud computing for more than 10 years, okay? Public safety is usually not an early adopter, but when it's becoming secure enough, reliable enough, resilient enough, you can see governments starting to adopt cloud computing for their different operations. You have agencies such as the CIA, FBI, police department that are already using cloud computing, and the best way to convince and to let the client or the potential customer speak with other customer that is happy and using the system on a daily basis. And this is the first thing. The second thing, I think that, you know, we are all using cloud on a daily basis, and cloud is bringing tremendous value for different things that we are doing. And I gave a few examples, okay? The ability to deploy fast, the ability to have elastic, increasing or decreasing the amount of call taking system that you are using as an example, the ability to give people to work from home, to work while they're driving, etc. So all those things, I believe, post-COVID will become very crucial and very understandable, okay, which will make customers basically more confident of having cloud computing. And I will add another thing is that you're going to see more and more states now moving to cloud call handling and cloud CAD solutions. And as an example, California is about to launch a bid for next-gen call handling solution in the cloud after they're implementing now their AZNet solutions. So moving from TDM into IP, this is something that is happening, and this is a gradual process, but it's here to stay.
Thank you, Amir. We have actually a lot of questions that are coming in from the audience. We'll try to navigate all of them in the last 10 minutes that we have. Amir, can you please elaborate about the single domain awareness platform?
Yeah, sure. Anything specific or just generally?
In general.
Perfect. So Carbyne is supporting currently more than, I think, like 25 states worldwide. In states, you have different agencies using different solutions, different call-taking platform, different CAD solutions, different RMS systems. But in the end of the day, the funds are coming from the federal government into the states, and from the states, they need to allocate the different resources to the agencies in order to handle the different situation that they have. So one of the Carbyne solution called C-Live Universe, and I'm encouraging the people to go after to the website and check it, but C-Live Universe can be deployed over the top. So we are absolutely solution agnostic. So no matter if you're using Vesta, Solacom, Rapid Deploy, or any other solution, Carbyne solution can be deployed on top of your current system. And this is the way that we are aggregating the information and basically using very smart computer vision technologies in order to bring location for every call, video, chat, coronavirus questionnaire, data sharing, and more on top of your current platform. Okay, this is what we've deployed in New Orleans. What's strong in the single domain awareness system, that is all those systems that we are deploying in 911, 311, EMS, fire, etc., are all connected to the same, I would say, brain. This brain is what you're seeing in the middle. So basically you can see here on the screen, the blue dots are 911 calls, the blue dots with the video sign are the one that you have videos with, and the red dots are one specific calls coming about coronavirus. But those calls can come from different agencies and can come from a doctor sitting at home that just received a 10-digit call, but is all going to be presented with smart filtering on a single domain awareness platform. In addition to different mapping capabilities, different heat maps capabilities, reporting systems, etc., that can give you basically the ability to aggregate information from different sources, in addition to getting into a specific ticket from the map, okay? And this is what you see here. Chad Labrie, our public safety expert, is one of the demos that we did. So the chat it's capturing, dynamic location is capturing, the video, of course, the coronavirus information, but also the ability to go to his number and see all the reports that he did. And we found it, again, very important because of the fact that, let's just assume that someone is quarantined now, and you need to know that he had fever 2 days ago, and now his fever is going down to normal. How I can do it quickly in my 911 center from calls that are arriving to doctors sitting at home. This is right. Exactly the reason using the domain awareness system.
Amir, a question came up after you mentioned the global presence of Carbyne. Can you share insight or trends that you see that are happening globally and here in the US as well that can impact the future of 911 operations?
Oh, this is an amazing question that I would love Chertoff and maybe to talk about it later. And I would say that you're seeing difference on the situation that the current governments are facing, depending on how fast they react to this global pandemic with real action items, and how, I would say, strong they are in you balancing between privacy and public safety. Okay, and I will take Israel as an example, which is extremely, I would say, forcing and active and aggressive with this fight against the pandemic, and using crazy solutions to track people, to trace people, to monitor them, to understand exactly who is quarantined, to track their phones, and to make sure that no one is leaving his home if he's quarantined. But in the end of the day, Israel have only 170 people died, 155 are above 75 years old. So what is the right balance here? So they fight it, they're using aggressive tools, but they are now releasing people, go back to work. They're releasing the kids going back to schools and kindergartens. So it worked. On the other hand, you have other governments that are still ignoring the fact that the pandemic is here, and this is exploding in their faces, and they are realizing that, a bit too late, and then, it's too late and a lot of people are dying. So this is a very interesting topic. I think the lesson learned post this pandemic, and we're going to see a lot of researchers coming out of it. But there is big variety of difference between different countries, and what tools and steps they're taking in order to fight this pandemic.
Perfect. Thank you, Amir. We only have about 3 minutes left, and I would like to apologize for all of our attendees who ask questions if we're not able to answer all of them. As I said, follow us on LinkedIn, and we'll share some of the questions and answers from Amir to those who have not been addressed during this session. Amir, we're going to ask you one last question that is coming in. And following, all those technological advancements, it seems that a lot more is being dropped on the shoulders of the call takers. More technology, more solutions, more apps, more companies are coming in. At the end of the day, it comes up to a single person. How do you simplify it? How do you help them make their job easier rather than, dealing with more information that is coming their way?
Yeah, wow, this is a great question. I think this is actually part of the Carbyne vision to have a one unified intelligence event management, all in one, instead of having 12 screens, and we saw it in different PSAPs in the US as an example, different GIS systems, different solutions that you're using in order to achieve one thing. Okay, at the end of the day, we believe that you're going to see more and more solution consolidation into single platforms. Okay, and you're going to see platforms that are becoming richer in terms of what kind of capabilities they can bring, if it's location aggregation, the ability to send text to people and get their location even if they didn't call to 911, video capabilities, speech to text, chat, text to 911, all should be combined into a single unified platform. And I'm not seeing any reason why call takers that are anyway overwhelmed with such a massive amount of solutions need to deal with, put their attention in different screens instead of looking at one screen that can give them, what basically Carbyne is standing for, which is we need to save lives, minimizing response times, and maximizing efficiency. And you can do it only if you're using one single end-to-end unified platform.